Sharon Mbugua, a resident of Nairobi County, is among the 50 million people living with epilepsy globally, according to statistics by the World Health Organization. A condition characterized by recurrent seizures, often accompanied by loss of consciousness and incontinence of urine or bowel movements due to abnormal electrical signals in the brain. Mbugua says she experienced a fast seizure in 2012.
I was fully convulsing, foaming at the mouth, shaking, eyes rolled back. A lot of the tests they did for me were blood tests around the heart. We went to see the cardiologist, but we were still very, not convinced, because even just a layman, you'd think if something made you black out, there's a problem with your head. And so we made a decision as a family that I traveled to India. So I went to Bombay. We traveled with my dad, and I was diagnosed there with a brain tumor. It was actually a cancerous brain tumor. At that time, it was stage 2, and it was surgically removed.
And just like any other patient, Sharon was optimistic that she would regain her health up until 2016, when she experienced another seizure. She was later to be diagnosed with epilepsy last year.
All I knew was I keep having seizures. Very unexpected. When I go to the doctors, they still can't see anything on my MRI. Typically, the reaction would be to up my anti-seizure medication.
Maybe around 3 hours.
According to Dr. Somesh Desai, a neurosurgeon from Apollo Hospital, most people diagnosed with epilepsy can live seizure-free if properly diagnosed and treated.
70% of the patients of epilepsy do respond to medicines. But there is a huge subset of patients, that 30% who do not respond to medicines. For them, there is some hope, and that is epilepsy surgery.
He says epilepsy can be triggered by
the infection. It could be because of the trauma. It could be because of the metabolic disorders. It could be because of the hemorrhage. Trauma, anything can lead to epilepsy. And in many of the patients of epilepsy, we don't know actually the reason of epilepsy.
Some of the common symptoms one should look out for, according to Dr. Desai, include:
patient has a jerky movements of the hands and the legs. There'll be frothing of the mouth, overturning or upturning of the eyes, and they will become unconscious for 5 to 10 minutes.
In the event you find yourself next to someone who is experiencing an epileptic attack, he advises that
make him lie on the bed, give him a left lateral position, so even if he vomits or something, he doesn't aspirate. Protect his tongue. If possible, you can put a wooden stick or a spoon in his face so he doesn't chew his tongue. And once the epilepsy settles, then you can call for a doctor.
Whereas prompt diagnosis and proper management is key in controlling epilepsy, the treatment gap in the country remains a major challenge in controlling the condition. Hence the need for partnership between the government and different stakeholders to also create awareness about this condition in order to enable epileptic patients at least live a normal life. Gloria Milimu, K24 for Health Unlimited.